Hello, I'm Emmeline Hawley, and in this video I'll be providing a quick overview of disease control disparities that occurred in colonial Africa during World War II. European powers had long meddled in the healthcare systems of their African colonies. However, the increased focus on Africa that occurred during World War II led Europeans to intensify their disease control within these regions. While improving the medical care available within their colonies sounded like a positive step for the European powers, their racist ideologies and desire to win the war at all costs led this new wave of disease control to be limited in several ways. First, medical centers, disease studying, and public health measures were usually applied only when European and American troops and citizens or Africans working for the war effort were being negatively affected. Second, colonial efforts to regulate illness were often paternalistic and ignored African medicinal traditions in their search for health. Finally, in an effort to better the disease control systems in the colonies, these colonial powers often dehumanized Africans by using them as test subjects. To begin, colonial disease control was strategically set up to aid Europeans, Americans, and Africans involved in the war effort. This pattern could be seen as far back as the mid-19th century, where English purity reformers rarely traveled to Africa to provide prevention training unless they were aiding their own troops and commanders in the colonies. Similarly, Europeans largely ignored other diseases circulating in Africa, such as malaria, until they began to affect their own people by claiming that the colonies should have generated their own money to fund medical centers. This pattern of European apathy towards African health concerns meant that many chiefs and village councils had been requesting that their colonial government implement better disease control strategies for years to no avail. However, this all changed when World War II began. For example, in the Gold Coast, Chief Kadri English had been asking the Commissioner of Accra to do something about the prostitutes coming in from Nigeria who were causing a wave of venereal disease in his community. His requests were denied, however, until 1941 when British, American, and Gold Coast troops began to be stationed in Accra. Only when these troops began to be negatively affected did combating venereal disease become a top priority for the colonies. Hospitals popped up, prostitutes were tested, and soldiers were cared for, providing a stark contrast to the indifference faced by the African people before their arrival. Even as more medical facilities and staff began to enter Africa, these resources were not evenly distributed. While malaria rates dropped consistently for Europeans in Nigeria from 1941 to 1944, African health appeared to get worse as both in- and outpatient counts rose from 1943 to 1945. This was likely due to the inadequate number of health facilities available to them. Though there were more African hospitals than European ones during the war years, European troops received proportionately more attention than Africans due to their smaller population. Overcrowding of African facilities often led to the triaging of disease concerns, as there was simply not enough staff or supplies to accommodate such a large percent of the population. The colonial government made it clear that they were investing in disease control not for the sake of those living in their colonies, but for the war effort by not providing the general African population with the same medical funding and resources as their troops, and by withdrawing large portions of their medical staff at the war's conclusion. In addition to neglecting the health needs of ordinary Africans during the war, when colonial powers did begin to invest in disease control, they often ignored local health traditions in favor of implementing paternalistic measures. While increased medical care was desired in some areas, methods of force and coercion used by the colonies were intense and often unwanted. In Brazzaville, for example, when World War II brought European troops and civilians to the city, disease control suddenly became highly regulated without much input from the Africans living there. As a result, hygienic habits such as trash disposal were tightly monitored, and many Africans were forced into examinations or isolation in the name of health. This trend continued elsewhere in Africa as European medical services strongly discouraged the use of traditional healing methods and attempted to undermine the existing medical practices of the various regions in favor of their own controlling methods. Finally, African patients had been dehumanized and experimented on for decades by racist colonizers who never agreed on an ethical code for medical practices abroad. However, the need for better disease control in World War II led to a sharp increase in testing. These inhumane practices ranged from excavating the dead in Brazzaville to widespread chemical pollution in Accra. In perhaps one of the worst examples of human testing, the British Lieutenant C.R. Ribbons substituted African men for horses in poorly ventilated mosquito traps as live, unprotected bait. This experimentation process placed them at a high risk for mosquito bites, and many of the test subjects attempted to leave the sheds at night to avoid a malaria infection. Even though these various methods of human experimentation were all meant to aid in disease control, they were dehumanizing and racially targeted the African population rather than the European and American populations who would benefit the most from the research. To summarize, as European powers intensified the disease control systems of their colonies during World War II, they did so in a manner that focused on winning the war rather than improving African health. They applied paternalistic measures of healthcare within the colonies that attempted to undermine systems of traditional medicine, and they utilized dehumanizing experimentation on African bodies as an expedient to improve the health of colonizers.